The public inaccurately assumes that, of course, federal agencies have thoroughly evaluated the science on the effects of wireless to children's brain development and thoroughly evaluated the science on impacts to trees, wildlife, and pollinators. But the fact is they simply have not. During council meetings, inaccurate statements such as that federal agencies have reviewed all the science have been repeatedly presented. Fact one, the FDA has not shown a systematic review of the totality of the science, such as damage to the brain, to the thyroid, or reproductive organs, nor has the EPA, CDC, NCI, WHO, or American Cancer Society. If you think that they have, then try to find such a report. Fact two, the EPA was defunded from setting safety standards in 1996. That's when the U.S. actually set wireless radiation limits from industry-filled groups. They were designed for humans, large men, not bees, birds, and certainly not trees. And it is a fact that there's never been any federal agency evaluation of the research on environmental impacts despite accumulating science showing damage to trees, plants, and pollinators. The reality is that there is no up-to-date scientific research review, period. Wireless radiation exemplifies the concept of a regulatory gap. There was no pre-market safety testing, no post-market surveillance for health effects. There's no federal measuring of the ambient RF levels in communities or in schools and homes. And there has never been a federal evaluation of the cumulative effect of long-term exposure, nor was there ever, or is there, a federal research review or reviews that consider the totality of the current science or assess if FCC's current 1996 adequately protect the public, especially and specifically children, from brain damage, despite an ever-accumulating body of independent evidence showing harm. So would you fly an airplane with safety regulations last reviewed in 1996, or have your children take a drug that literally hundreds of scientists are warning you about, and which has never been properly evaluated for safety, and of which there quite literally is no federal entity with health or environmental expertise in charge of the ambient radiation? AT&T and Verizon have mobile protection plans that state coverage is excluded for pollutants, and they define pollutants to include non-ionizing microwave radiation. So why would the council support measures that allow this pollutant into the homes of school children and neighborhoods? There's no safe level of lead because for children, there's no amount of brain damage that is acceptable. Studies have linked radiofrequency radiation to damaged memory and decreased brain cells. So what is a safe level for children? What is a safe level for birds or bees? The federal government has never investigated that issue. The county should be educating school children on how to minimize RF exposure, and instead of purchasing wireless, they should have safe technology so kids can connect at home without this radiation. Safe technology exists. I'm using it right now. And as the feds have dropped the ball, the council has a responsibility to ensure the community is safe. In fact, my letters to the Montgomery County website were actually key evidence in our lawsuit against the FCC, because I have documentation from the FDA and NCI clarifying that their safety determinations, that they do not make safety determinations on the totality of the science. I also wrote the council regarding the inaccurate information presented at council meetings, such as that the FDA has reviewed all the science and have never received a response, nor have any corrections gone out to the public. Thank you.
Thank you.